Treatment for panic disorder generally involves three parts. Number one is understanding what it is they're suffering from. That this is not a heart attack, this is not a mental nervous breakdown, this is not lung disease, stomach disease, just insomnia. This thing that I have has a name. And so education about the disorder is part one. Part two is therapy. Therapy that allows people to learn to master the attack itself, whether it's through deep breathing or some other type of relaxation or some type of meditation, but some behavioral treatment of the disorder, both behaviorally and changing the thoughts, what we call cognitive therapy, so that people can learn to talk to themselves more positively during the attack. What do I mean by that? This is a panic attack. I've had this before. I always get over it. I get over it faster if I get control of my breathing and my pulse and other things. And then the third part of treatment involves medication. Does everybody need medication? Not necessarily, but many people are benefited by medication. And medication falls into two groups. Number one, drugs to prevent the recurrence of the attacks, and these are usually drugs that we typically know as antidepressants. Remember, we call drugs what they first get FDA approved for. So Zoloft, for example, was first FDA approved for depression. We call it an antidepressant. Later on, they found out Zoloft worked for people with panic disorder, even those who were not depressed, and the FDA approved it for panic disorder. But we still call it an antidepressant because that's what it first got approved from. And I say that because a lot of people have the wrong idea. Why is this doctor giving me an antidepressant? I'm not depressed. I have panic attacks and panic disorder. So drugs that work for depression often work to prevent panic attacks, and then to treat the attacks when they get out of hand. Often we'll use drugs called tranquilizers, drugs with names like Ativan or lorazepam or Xanax or alprazolam, or drugs like Klonopin or clonazepam. Those drugs treat the attacks but not the condition. So they'll reduce the anxiety during the attack, but they don't prevent the next attack.